One of the challenges in mental health nursing for undergraduate students is that management of themselves in the face of mental health settings. So one of the things we recognise is that students need some support around resilience, around how to manage their emotional responses to some of the acute mental health disorders that they might see, and also to think about what may be a problem that results in them being confronted on both a personal and a professional level. So depending on their experiences, they may or may not have come across mental health disorders in their past, and indeed chances are they possibly haven't been onto an acute mental health ward. So those things can be quite difficult and certainly are recognised as points of stress in a student nurse's career. The approach of the teaching team, the mental health teaching team, was to develop a tutorial which is based very much on recognising personal stressors. So trying to elicit from the students for them to think about how they manage their own personal situations, how they recognise that they're getting stressed, how they recognise that they're finding something confronting, or if they already recognise there's something from their own past that they might then need to address before they go on to placement. During the tutorial, we use the situational based contexts in order to help them build their own resilience, recognise their own stresses, and also think about future planning for questions. So an example might be trying to help the students develop a narrative for how they're going to manage a patient in a mental health setting asking them something personal or inappropriate. So some of the outcomes from that tutorial are that students are better prepared for the context of placements in mental health and some of the things that they might see, some of the things that they might hear, and also some of the things that they may personally experience as a result of being exposed to mental health in those situations. We also give the students some communication skills in terms of deflecting questions and keeping it on a professional level rather than a personal level. And an example from a student came back to me that said, if you hadn't have told me that a patient might ask me for my phone number, I wouldn't have known what to do, and I wouldn't know how to manage that without being seen to be rude or confronting to the patient. So it's helping the students actually develop their professional identity in terms of them being mental health professionals. We also talk through elements of mindfulness, being mindful of yourself, being mindful of what's going on around you, and thinking about how you might problem solve some situations that may impact on you both personally and professionally. So I think moving forward, from our experience as a team, some of the tips that we might give you thinking about how to prepare students for some of these confronting situations that they face would be very much the team experience. So the team that teaches into mental health are experienced mental health professionals, so they've had a wide range of experiences that they can give examples that have meaning and authenticity to the students, and that really helps them to give a context but also understand some of the communication skills that have been employed. We also as well would recommend, I think, that you constantly review what's happening in mental health services, and one of the best ways to do that is obviously talking with service providers, industry providers, and also the students themselves. So I'm very aware of asking the students to repeat their stories and explain what it was like and explore some of those feelings and some of the responses, but also in their written reflections of placement, recognise some of the areas that they find challenging and then embed that into future tutorials. Thank you for listening.